Your Excellency, Governor Wambora, Chair of Council of Governors, Director, National AIDS Control Council, Dr. Ruth Masha, Global CEO, Amref Health Africa, Dr. Githinji Gitahi. It's interesting by coincidence, we are sitting together next to each other on the same table because there are people who thought we would never even talk. So I think it's a good demonstration that Kenya is bigger than all of us. And that's why we are here today. Representatives of the various agencies, Global Fund team, who are also joining us virtually, ladies and gentlemen, all protocol observed. I'm really honored to join you here today on the signing of this grant on behalf of the 65 community organizations that will implement activities under the new HIV grant. Allow me on behalf of the beneficiaries, the implementing organizations, and the Kenya Red Cross Society to convey a strong message of appreciation to the Global Fund, Board, the Kenya Coordinating Mechanism, and the Ministry of Health for extending this critical support to ensure that as a country we continue the fight against HIV/AIDS. This is the third grant the Kenya Red Cross is signing, but my first as Secretary General, and you can imagine a very serious induction into this position in 2020. I have, however, been involved in the implementation of previous grants in different capacities. And my most interesting experience managing HIV programs at the Kenya Red Cross, however, was long before the engagement with the Global Fund. Nearly 15 years ago, the Kenya Red Cross Health Department, which I headed as director then, having been seconded to Kenya Red Cross by Ministry of Health, decided to implement HIV programs, first targeting female sex workers in Mombasa. It was not an easy start, as we had to overcome a lot of prejudice and opposition, both inside the organization and outside of the organization. We also implemented a number of other interventions, especially along Kenya's main transport corridor, including Mariakani, Mlolongo, and Salga, which was then dotted with HIV hotspots. Ensuring that the key populations along these hotspots access services has been a key concern for the society since then. Our partnership with the Global Fund in 2011 was therefore a major game changer, giving us the resources needed to expand the reach and increase service provision to some of the most hard-to-reach population groups. Over the last 9 years, this funding has enabled us to reach millions of people with various services. Under the just concluded grant, Kenya Red Cross worked with 65 recipients in 37 counties. This will be sustained under the new grant, which will now extend to 46 counties. The grant portfolio has also increased, with a number of modules increasing. The new grant will enhance community-level PMTCT intervention to facilitate elimination of mother-to-child transmission and also enhance the support and services to adolescent girls and young women. In the recent past, there are increased cases of human rights violation reported across the country, particularly directed towards key populations. Through this Global Fund funding, we look forward to responding to the needs of gender-based violence survivors and put in place mitigation measures against human rights violations. Distinguished guests, the Kenya Red Cross works under the Global Fund program and is anchored on its mission of being a community facilitator. As a society, and this is the principle within the Red Cross movement, we have a lot of faith in what the community can do for itself with some degree of empowerment. We have seen the tremendous work the 65 sub-recipients under the previous grant have done, reaching millions with key services such as testing, care, treatment, psychosocial support, among others. My call is that as a country, indeed all of us really, to invest more in community-level structures that promote preventive health actions. If there is anything that COVID-19 has taught us about investment in health, is that we will never have enough health facilities, and therefore putting resources at the community level is key. I am pleased and want to commend the efforts of the Global Fund Board, the KCM, and all of you gathered here for your relentless efforts in ensuring that the voices of these communities are on the table from the grassroots through to the national and global level. As an organization, we are proud of our role as auxiliary to government, both at national and county levels, and this has been our main focus as Global Fund PR and the other programs that we partner with government, as ours is to complement government efforts. We therefore appreciate this privilege to have played this critical role of PR, supporting government efforts to the fight against HIV. I would like to commend NAC for taking a lead in bringing the discussions on HIV in emergencies on the table. We need to ensure that our disaster response mechanisms and tools integrate HIV services during disasters. The future of humanitarian action, I say, is local. HIV and AIDS is still a disaster and should be managed as such. And for an effective response, as local as possible is the only way to go. Therefore, ladies and gentlemen, I just want to take this opportunity to urge all of us who have been entrusted with this crucial intervention to work together because we are all serving the same communities. Closer collaboration and sharing of lessons will be of great value. Thank you and God bless you all.